Heart disease is the leading cause of death in the world. 70 to 80% of heart disease relates to coronary artery, the blood vessels that carry blood to your heart. AI Medic is a company that develops medical imaging software, which is helping in diagnosing coronary artery diseases and provides appropriate, customized treatment to patients.
AI 메딕은 환자 맞춤형 심혈관 질환 진단 기술을 개발하는 회사입니다. AI와 컴퓨터 시뮬레이션을 통한 혈류 해석 기술을 이용해서 보다 효율적이고 안전한 진단 기술을 개발하고 있습니다.
From the conventional invasive test method, which is risky when inserting the catheter indirectly, we have improved and developed full auto segment, the non-invasive test method to check the narrowed part of the cardiac and cerebrovascular vessels from only CT data. That helps make the process safer. The patent-pending full auto segmentation method reduces the duration of CFD simulation from more than 4 to 8 hours to less than 5 minutes, enabling full automation of CFD simulation. The FFR index indicates the extent of the narrowing of cardiovascular system. AI Medic's CT FFR blood flow diagnosing simulation technology combines computer simulation technology with heart physiology theory to diagnose FFR figures non-invasively. This test method is safer and more accurate than the conventional invasive test method. Besides diagnosing the FFR only from the CT data, it also can be used after stent placement surgery of blocked up blood vessels, considered as the most optimal treatment.
많은 의료기기 회사들이 관상동맥 질환을 비침습적으로 진단하기 위한 의료기기 소프트웨어를 개발하여 사업화를 추진하고 있으나 선발 주자인 하트플로사의 원천 특허에 막혀 사업화에 어려움을 겪고 있습니다. AI 메딕은 독자의 특허 기술을 개발하여 경쟁사의 특허 장벽을 뛰어넘어 자유롭게 사업화를 추진할 수 있는 세계에서 유일한 회사라고 할 수 있습니다.
Not just a usual medical imaging software, AI Medic will build a patient-specific diagnosis and treatment convergence platform based on AI simulation to predict side effects, optimal treatment, and support medical practice effectively.
This is an FFR simulation software which can be operated on-site. It is composed of two parts. The first part performs automatic segmentation of coronary arteries, and the second part performs CFD simulation for the estimation of FFR of patients. For the non-invasive FFR estimation of a patient, first of all, we must get a 3D coronary artery model of a patient. To get a patient-specific coronary model, we select the CT image file of the patient in the DICOM dataset. By pressing the auto segmentation button, the software performs automatic segmentation of coronary arteries of the patient. It takes about 7 or 10 minutes to complete the segmentation of coronary arteries, which is depending on the CT image quality and format. When the segmentation process is successful, Conform Message button is displayed, and in order to proceed, press it. The 3D coronary artery model of a patient is displayed in the upper right window. When the whole heart button is pressed in the menu, the combination of whole heart elements is displayed. Also, each element of the whole heart, for example, left ventricle, aorta, left atrium, right atrium, and right ventricle, can be displayed by selecting each corresponding button in the menu. Vessel analysis can be performed by selecting the CPR button. In the lower left window, the cross-sectional view of a vessel and a plaque component of a vessel inside the vessel wall is displayed respectively. The NPR and CPR views of a vessel are shown in the upper left window. Also, measurement of a stenosis can be performed by using the area and diameter graph function. For further FFR simulation, the 3D coronary artery model of a patient can be exported in STL format by pressing the Export STL button. From now on, using the patient-specific 3D coronary artery model, the second part of the software performs blood flow simulation, which is called as CFD LPM model simulation. Our CFD LPM model simulation uses only a 3D coronary arteries model for CFD simulation and LPM model for microvascular simulation, which is the unique feature of our CFD LPM simulation model. To perform patient-specific blood flow simulation, input some patient data such as height, weight, and blood pressure, etc. into the dialog box of the software. When the 3D coronary artery model of patients is shown in the window, selections of inlets of RCA and LCA are needed. Only pushing the FFR simulation button in the menu, the patient-specific blood flow simulation is performed automatically. Also, some pre-processing steps such as center line calculation, branch clipping, and volume mesh generation are performed automatically in the second part of the software. After the pre-processing steps, CFD and LPM simulations are coupled to solve the blood flow in the 3D coronary artery model. CFD simulation is to solve the Navier-Stokes equations based on the finite elements method for the 3D coronary artery model. Only for the second part of the software, it takes 10 to 15 minutes to perform patient-specific FFR simulations depending on patient status and PC conditions. As a result of the blood flow simulation, we can get useful quantitative values such as FFR, shear stress, streamline, velocity, and distribution of blood pressures along blood vessels. Various quantitative results are displayed in the result window, especially FFR values are displayed by pointing points of vessel with the mouse. Also, a virtual pullback FFR graph can be simulated by pointing any proximal and distal locations.